As long as oral therapy is not there, there is not much of interaction of the chemotherapy agents with the food. Of course, there are some TK molecules which are got food and drug reactivity, and the patient is cautioned about it. Otherwise, intravenous chemotherapy does not have much of food interaction, but after chemotherapy the patient is advised eat always freshly prepared food, not to eat stale food or canned and tinned and frozen foods, because infection rate may be high, including gastroenteritis. As the immunity will be low following chemotherapy and the blood counts are low, these patients are prone for infections, intercurrent infection. That's why they are guarded about these intercurrent infections by following some precautions. Food, always take home cooked, freshly made food and hot food rather. Secondly, a lot of vegetables and green salads fresh are advised. Keep the diet light and very balanced. Outside food is not encouraged. Similarly, going to crowded places, one may get infected because of flu and other virus. He is advised not to go to crowded places, and also if necessary to go outside, put on a mask or cover himself well, so that the dust and pollen and the infection would not enter through the nose into the respiratory tract, and they won't develop respiratory infections and pneumonia. So gastrointestinal infections have to be safeguarded against, respiratory infections have to be safeguarded against, and any other onlookers, I mean family members or friends who come to spend time with the cancer patients are also advised to maintain a distance and avoid the visit if they themselves are suffering from any upper respiratory infection or otherwise. There are some of the precautions to be observed by chemotherapy patients following the chemotherapy, and as long as the chemotherapy session is on, it may be in cycles over a period of 6 months. Safe precautions are always advised. So, my dear friends, I have covered as many aspects of chemotherapy and doubts expressed by my patients and their relatives. Hope it has been very useful to you. And one need not be very apprehensive and scared about chemotherapy. No doubt it has got some side effects, but it's never painful. And there are medications nowadays in improvised chemotherapy setup to give, to preempt and prevent these side effects. When it is necessary, we should not go back on the pretext of either apprehensive or side effects, and should go for the treatment with full confidence under the able guidance supervision of a trained and experienced medical oncologist. Anytime you are welcome to call me at the Pace Hospital for any doubts regarding the chemotherapy